Story 1. A woman I knew had pain around her jaw for weeks and later experienced a crushing feeling in her chest. Everyone assumed it was anxiety or tooth pain. Turned out she was having a heart attack. A heart attack can present as jaw pain or a toothache. Story 2. My wife was misdiagnosed with panic disorder for a long time. It turned out to be epilepsy, and she was having seizures, not panic attacks. Story 3. Celiac disease. After a decade of trying many medications and having counselors tell me I must be anxious about something, I learned that panic attacks don't just come out of nowhere. It turns out untreated autoimmune disorders can damage your nervous system. Story 4. My infertility was caused by endometriosis. I have since lost organs because of the disease. I was told I was not trying hard enough to get pregnant and that I should relax. I was diagnosed only after an ovarian cyst ruptured. Story 5. Before I was diagnosed with multiple sclerosis in the emergency room, my doctor made me feel like I was losing my mind. Story 6. I experienced complex trauma due to neglect beginning in infancy and continuing through my childhood. I also learned that neglected children often do not recognize that they were treated neglectfully. Story 7. Cancer. Neuroendocrine tumor, specifically. Fortunately, it was slow-growing and was removed with one surgery. It took 10 years to get a proper diagnosis. It was shocking that Lexapro did not fix it. Story 8. Chronic migraine with aura, pelvic floor dysfunction, chronic intermittent acid reflux, and sleep apnea. For years, I was told my aura symptoms were imaginary and caused by anxiety, until I finally saw a neurologist. It turned out I was not imagining the vertigo, visual changes, sensory sensitivities, motor difficulties, tinnitus, numbness, tingling, or weakness. These are all part of my migraine aura. Anxiety is a common assumption for any symptom in women. Story 9. Anemia from internal bleeding due to stomach ulcers and endometriosis. I kept telling my doctor that I had an impending sense of doom and felt I was going to die, but he sent me to a therapist instead. One day I fainted on the street, nearly bled out, and needed 2 blood transfusions to stabilize. The ulcers were caused by taking non-steroidal, anti-inflammatory drugs for my endometriosis pain. It is common for women to have hidden iron deficiency. You can have normal hemoglobin but low ferritin. Many of the symptoms mimic anxiety, including panic attacks, heart palpitations, shortness of breath, insomnia, stomach pain, headaches, vertigo and dizziness, blurred vision, and muscle spasms. Story 10. I knew a man who kept saying he was having heart attacks, but the doctors insisted it was anxiety. Years later, he found out he had about 10 small heart attacks. Story 11. A magnesium deficiency and an iron deficiency can cause irregular extra heartbeats. Story 12. First time. A form of tachycardia. They were not sure exactly what was wrong, but they confirmed it was not only anxiety. Second time. A kidney stone. Story 13. The sad part about these comments is that most replies are from women. Story 14. My anxiety symptoms turned out to be caused by a pulmonary embolism in the lower lobe of my left lung. Story 15. I was diagnosed with a brain tumor twice. Both times I did not feel normal. Consistent headaches, forgetfulness, loss of time, balance problems, ringing in my ears, mood swings, 1 minute happy as a clam, the next I was crying, and extreme fatigue that was not normal. Simply cutting the grass could put me down for 2 days. The first time my doctor blamed it on anxiety, then depression, then told me I was just getting older and to try exercising more. This went on for 2 years until I had a spell while grocery shopping. I do not recall walking through an entire department and finally came to when my daughter yelled, "Dad, are you okay?" I went to the doctor the next day and said I was not leaving until we found out what was wrong. One magnetic resonance imaging scan later, we found a tumor at the base of my brain wrapped around the nerves and spinal cord. I had surgery a month later and they removed it all. 2 years later, all of the symptoms returned and I asked for another magnetic resonance imaging scan. We found a clival chordoma, a very rare bone cancer of the skull and brain. It is so rare that they call us the 1 in a million gang because that is the ratio of being diagnosed with a chordoma. I had surgery to remove the tumor, but unfortunately it entered my dura mater and spine, so it will more than likely spread. Long story short, you know your body and know when something is off. Do not brush it off and do not let others dismiss it. Be your own advocate for your health and tell your doctors what you feel you need. If they disagree or gaslight you, find a new doctor. They call it practicing medicine for a reason, and most of the time they base your diagnosis on the first result from an online medical resource or clinical reference that matches most of your symptoms. Story 16. I developed cardiotoxicity from the chemotherapy I received. The best part is that it is a known side effect. Story 17. Attention deficit hyperactivity disorder, autism, postural orthostatic tachycardia syndrome, and hypermobility spectrum disorder. I am still working on getting the healthcare system to believe me and resisting constant gaslighting. Story 18. Optic neuritis. The doctor told me to go have a beer. In his defense, I was not presenting with pain, just blindness. That should have sent me immediately to the hospital, but I did not go. I kind of enjoyed the beer, as much as one can when terrified of not being able to see. Story 19. I have post-traumatic stress disorder. It takes me an extra hour to get to work because I avoid the town where my ex lives out of fear I will see him again. Story 20. Turns out it was a fascist takeover of every branch of my country's government. Story 21. During perimenopause, my first symptoms were heart palpitations. I thought I was having heart attacks. My doctor dismissed them as anxiety. Story 22. I am female and have multiple autoimmune conditions, so you are describing the last 2 decades of my life with 50% of my new doctors. 20 years ago, anxiety was what I told them I had, but it took 6 specialists and 1 knowledgeable doctor to finally agree. My father and grandmother have the same condition, psoriatic arthritis, and I had most of the textbook symptoms, yet I was prescribed Lexapro. Story 23. I had low iron, low vitamin D, and a stressful home life. I moved out, started therapy, and tried a few different medications that did not really work. After a couple of years of therapy, I started somewhere new, and that therapist diagnosed me with post-traumatic stress disorder within 3 sessions. I have now had 4 eye movement desensitization and reprocessing sessions after being on the waiting list for almost a year, and they have been helpful but hard. I did not realize how severe it was until we went through the specifics, but the eye movement desensitization and reprocessing has been very effective, and I have never felt so calm the week after a really good session. Keep trying to figure it out and keep working on yourself. Do not just call it anxiety and move on. Story 24. I had a bad gallbladder. Anxiety contributed, but it was not causing me to vomit every day. My gallbladder was. Anxiety sometimes causes a mild stomach ache, but it was never as debilitating as the gallbladder problem. Story 25. I had a heart condition called premature ventricular contractions that caused a fluttering feeling in my chest. The condition triggered medical anxiety, so my anxiety had a clear physical cause. Story 26. I have small intestinal bacterial overgrowth, an infected wisdom tooth, a fibroid, and a mystery object on my mammogram. Story 27. Fibromyalgia, old concussion symptoms, post-viral syndrome, and a surprise cyst. It felt ridiculous that the cyst was the last diagnosis since it was the only condition they could actually measure and therefore could not deny. I felt both relieved and frustrated. Story 28. I had gallstones blocking the bile ducts in my liver that required emergency surgery. The paramedics who had been called when I collapsed in the street from the pain told me it was probably anxiety. I had to argue with them to take me to the hospital. Story 29. I had a peritonsillar abscess. I was asked to leave the emergency department to make way for patients who were really sick, while my high fever and inability to swallow were dismissed as anxiety. Story 30. I had epileptic seizures for years and told my entire family that something was wrong. My mother said I might just be psychic. They went undiagnosed until I finally had a convulsive seizure at work in front of everyone. Story 31. Because of idiopathic intracranial hypertension and vestibular migraines, I experienced extreme anxiety that the floor would collapse beneath me. It was the first time I felt a psychological effect before the physical ones. No one took me seriously until I woke up feeling as if I had just stepped off a boat and had lost sensation on the right side of my face and the left side of my body. Story 32. Brain tumor with comorbid epilepsy. I experienced loss of time, blanked out for extended periods, and had periodic headaches that felt like being stabbed through the skull. Story 33. With co-occurring autism and attention deficit hyperactivity disorder, I have challenges with interoception and alexithymia that cause me to label any internal distress, from slight discomfort to pain, physical to emotional, belly to throat, as anxiety. I was applying a blanket label to a broad range of internal discomforts, including sensory overwhelm, suppression of restlessness and stimming, and basic physical needs such as hunger and thirst. Most of these are much easier to address than subtle anxious thoughts. I am having to unlearn a lot of cognitive behavioral therapy habits because automatically asking, "What am I anxious about? How can I refute this anxious thought?" is unhelpful when the cause is actually that I am too warm. Cognitive behavioral therapy often leads me to find or create anxious thoughts on top of the original discomfort. Likewise, breathing and mindfulness are not helpful when I actually just need to remove a layer of clothing. Medication for attention deficit hyperactivity disorder removed a large proportion of the pervasive distress I had long called generalized anxiety. It mainly soothed my restlessness, both physical, no longer feeling like I was holding the lid down on a pressurized bottle, and mental, because it is hard to relax into and focus on tasks when your brain is constantly telling you about the million other things you could or should be doing right now. There is still anxiety, but with the diagnoses and medication, it is much easier for me to recognize when distress is or is not caused by anxious thoughts, so I can apply the most suitable tools for different types of distress. Similarly, they were autistic meltdowns, not panic attacks. Story 34. Ventricular tachycardia, ischemia, and heart failure with reduced ejection fraction are effects of infection and my genetic disorder. Story 35. I had terrible stomach pain and was told it was anxiety, but it turned out I was having gallbladder attacks. When they finally found the cause, they removed the gallbladder about a month and a half later. The pain was so bad that sometimes I could not even walk, and it was chalked up to simple anxiety. I felt immediate relief after waking up from surgery, and the recovery was a breeze compared to how I had been feeling. Story 36. I had a friend who went to the doctor for a strange sensation in his arms and legs and worsening weakness. He was told it was anxiety and was sent home. 2 days later, he woke up paralyzed. He was diagnosed with Guillain-Barré syndrome and spent a month in the hospital. He recovered, but it took him a few years to return to normal. Story 37. The first time it was a calcified gallbladder. The second time it was appendicitis. The third time is currently unknown, but I can almost guarantee it is not anxiety. Story 38. The first time I had a fractured spine. The second time I had a serious autoimmune disease that was fortunately caught before it caused a complication. Story 39. I was told my entire life that I had anxiety and crippling panic attacks. Turned out to be seizures. Feels like everyone knew except me. Story 40. After years of unexplained stomach pain, I was sent to a class to manage anxiety. Turned out to be gallstones. Story 41. I was exhausted and stressed for a long time. My hair fell out and I went to doctors for a while. They told me I was just stressed about my job. Then I went blind in my right eye and my face went numb. Turned out I had multiple sclerosis. My neurologist said I should not be mad at my general practitioner, as they may only see 1 or 2 people with it in their career. Story 42. Ironically, it was classified as a mental health issue, but it was pathological dissociation. I will not go further than that. I was too young and had an underdeveloped ability to express myself verbally. They interviewed me like an adult. The clinic psychologist became so frustrated that she told me it was just anxiety. I do not blame her. I was stuttering and speaking incoherently. I had become anxious when discussing the topic because I had been bullied, yelled at, and threatened about it. I wish I had been taught how to speak my mind and express myself. Because it was public health care, I was allowed only 6 appointments without follow-up or monitoring. I returned home with the same symptoms: losing consciousness, inability to recall events, and a lack of control over my body. Story 43. Temporal lobe epilepsy. The panic attacks were focal seizures. Story 44. Why do I feel that most of the commenters will be women? Story 45. It was intractable medication-resistant bilateral temporal lobe epilepsy. Story 46. Clinical anxiety is the kind that requires therapy and medication, not nerves or overthinking. Story 47. I took the Crayos assessment administered by my mental health nurse practitioner. The results showed severe depression, severe anxiety, and post-traumatic stress disorder. No surprise, as I was diagnosed years ago. One revelation that was somewhat surprising was adult attention deficit hyperactivity disorder. Since starting medication for attention deficit hyperactivity disorder, the symptoms of the other conditions have lessened. Story 48. Turns out I just had to try harder and act more normal. No, just kidding. It was attention deficit hyperactivity disorder. Story 49. I have complex post-traumatic stress disorder, obsessive-compulsive disorder, attention deficit/hyperactivity disorder, and generalized anxiety disorder. Everyone who could told my mother I needed help, but she did not listen. Story 50. Shingles. A textbook case except for my age. I am in my 30s. The doctor took one look at the affected area and decided it was anxiety caused by the death of my dog. But my dog is alive and well. Story 51. The problem was vision issues. Once they were finally addressed, anxiety improved. Go figure. Story 52. My ex-husband had several short episodes of severe nausea, sweating, and abdominal pain. I convinced him to seek medical attention but could not go with him because of a work conflict. I am not sure how he described his symptoms to the doctor, but the doctor apparently concluded he was having a panic attack and advised him to see a therapist for anxiety. 2 weeks later, he woke up and began vomiting continuously. I took him to the emergency room. He was admitted with pancreatitis and required removal of his gallbladder. He also thought at one point that he might be eating too much red meat, but that was not the cause. Story 53. It was dismissed as just anxiety, but anxiety that cripples you socially and professionally is still important to address. Story 54. Borderline personality disorder. To be fair, it overlaps with many other conditions and can be hard to diagnose. Story 55. My mom was told the pain in her knee was nothing and was referred for anxiety when she kept coming back to the doctor's office about it. It was cancer. Story 56. I have a very large hiatal hernia, probably from a work accident. The doctor told me to go for walks and find a boyfriend. I had to beg for a referral. Story 57. When I was 11, I constantly had a tummy ache. Doctors could not figure it out, so they decided it was psychosomatic and prescribed Xanax. When I was 19 and in college, a doctor had me do an elimination diet for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Turned out I am extremely intolerant to garlic. Story 58. It was chorioamnionitis. I woke up one morning at 38 weeks and my resting heart rate was in the 130s and my blood pressure was in the 90s. We went to the hospital and my baby's heart rate was in the 160s. The midwife came in, lectured me about anxiety, told me to relax, and gave me hydroxyzine, saying it was not good for my baby and that I needed to calm down. The attending came in and an hour later admitted me for an induction. At the time, they did not know what was wrong, but my baby and I were in distress. I had my son the next day and he spent 2 days in the neonatal intensive care unit. I crashed and nearly went septic during labor. I did not get the diagnosis until my baby was 3 weeks old. We both could have died. Fuck you, Megan the midwife. Story 59. I was told my crippling chest pain was gas, but it was not. I had a heart attack at 33. Story 60. I found out yesterday that the wife of one of my good friends has cancer. She is in her late 30s. They have a 1-year-old child. She has had pain on her right side and in her ribs for about 6 months. Her primary care physician attributed it to anxiety and referred her to a psychiatrist, who prescribed antidepressants. One night, the pain was so severe she could not sleep, so she went to the emergency room. The emergency room found signs of cancer in the liver and lungs. She does not know details yet because the oncologist is still reviewing her scans. It has been about a week since the emergency room visit. Story 61. I had a heart arrhythmia called supraventricular tachycardia. When the doctors finally recorded it, they said my heart rate was over 230. I had to get an ablation and almost received a pacemaker while I was on the operating table. Story 62. Asthma. Who knew my breathlessness was real? Thanks for taking me seriously, Mom, and to all those dismissive nurse practitioners, physician assistants, and medical doctors who told me it was probably just anxiety while I was growing up until I went to cosmetology school where it drastically worsened because of the chemicals in the air. Story 63. I have Hashimoto's thyroiditis and anxiety. It took a long time to diagnose my physical symptoms because they were dismissed as psychological. Story 64. I had a benign stomach tumor that caused chest pain from reflux, lower in the chest rather than the throat, and made me think it was anxiety because of tightness and an odd sensation. I was 22 and was told I was too young to have serious issues. I saw a doctor for 6 months with constant pain and discomfort seeking relief. None was offered until I vomited 32 times in a single day and was finally admitted to the hospital for tests. Story 65. I had a seizure and was brought in by ambulance. The staff asked if I had relationship problems or extreme stress in my life and sent me home, saying it was anxiety. After I went home, I had another seizure. I was having a severe reaction to medication. Story 66. Well, it is anxiety from teaching and coaching, but it manifests as an arrhythmia. Story 67. I have autism and attention deficit hyperactivity disorder, complex post-traumatic stress disorder, and obsessive-compulsive disorder. Attention deficit hyperactivity disorder medications and therapy have been life-altering. Story 68. Endometriosis. One of my ovaries was fused to the back of my uterus. I am pretty sure I am infertile now, as we have tried to have children for 5 years and treatment has failed even with intrauterine insemination. We cannot afford in vitro fertilization. Story 69. It was a massive pulmonary embolism. My heart rate was 130 while I was lying on my couch, and I experienced excruciating back pain and anxiety. I have a history of depression and anxiety, so my symptoms were minimized. The doctor still ordered blood tests because I insisted that something was not normal. A doctor called me urgently with the results and told me to call an ambulance. Story 70. From age 16 to 30, I was told I was having anxiety spells. It turned out I was forming golf ball-sized gallstones, and by age 30, I developed sepsis. Story 71. Post-traumatic stress disorder is the main cause of my anxiety. I have been prone to anxiety attacks for decades, so when I developed high blood pressure, I disregarded the doctor's diagnosis because I just knew it was anxiety. In reality, it is post-traumatic stress disorder and anxiety, with high blood pressure as an additional issue. Story 72. It was an abusive man 13 years older than me who told me I was anxious and needed medications. Story 73. I have mitral valve regurgitation and trigeminal neuralgia. My neck was severely damaged in a car accident and it compresses a nerve, causing one side of my head to feel as if it is being burned. Story 74. At various points in time, it has been asthma, postural orthostatic tachycardia syndrome, Ehlers-Danlos syndrome, a broken foot twice, and most memorably blood clots in my lungs. Story 75. I had a massive volleyball-sized tumor on my ovary. Once I had my surgery, the anxiety left the building. It took almost 5 years to get someone to listen to me. Story 76. I have epilepsy. I was told my focal aware seizures were anxiety attacks. Story 77. Leaky gut, irritable bowel syndrome, high blood pressure, insulin resistance, autoimmune issues. Story 78. Post-traumatic stress disorder resulting from childhood abuse. They also have bipolar disorder and are on the autism spectrum. Story 79. Misogyny, arrogance, and time limits on how long you can spend with a patient in medicine. Story 80. I had a family member who said anxiety was made up and just an excuse to be lazy and avoid work. They had never experienced anxiety, so I let it slide. However, it turned out to be panic attacks caused by a very stressful job. Story 81. Autism, attention deficit hyperactivity disorder, chronic nervous system disorder or illness, laughing out loud. Story 82. Mine really is just anxiety, which feels like I am dying most of the time. Story 83, Autism Spectrum Disorder, Attention Deficit Hyperactivity Disorder, Post-Traumatic Stress Disorder, and Premenstrual Dysphoric Disorder. I do not think I have anxiety. Story 84, I have anxiety, and my bipolar type 2 amplified it. Story 85, I wasn't told it was anxiety. They said it was depression and put me on antidepressants, which were no help at all and had so many side effects that my anxiety went through the roof. I stopped taking them before they killed me. It was 20 years before I could see it for what it was. Story 86, my birth control is causing high blood pressure, migraines, and panic attacks. Story 87, Post-Traumatic Stress Disorder. I described a flashback to many doctors over 20 years. I was finally diagnosed at a new mental health hospital by a bright young doctor. Because of autism, I never used the term. It did not occur to me that my experience was a flashback. Story 88, Graves' disease, hyperthyroidism. By the time I got my thyroid checked, my thyroid levels were over 100. I could easily have gone into thyroid storm and died. Story 89, Complex post-traumatic stress disorder, abandonment issues, psychogenic non-epileptic seizures, small intestinal bacterial overgrowth, rheumatoid arthritis, and autoimmune disease, and Raynaud's disease. Stomach pain while eating may be related to small intestinal bacterial overgrowth. Story 90, Spies are trying to burn me, and people are trying to traffic me. Story 91, The dentist told me my severe jaw pain was due to grinding my teeth in my sleep, and that it was caused by anxiety. It was actually an abscess that he had failed to diagnose for at least 4 months. I had specifically gone for a checkup because I believed it was an abscess, but the dentist dismissed me more than once. I ended up going to the hospital when the pain left me feeling suicidal, had emergency surgery, and now have an ugly scar on my neck where they had to cut because the abscess was so severe. Story 92, I have autism spectrum disorder, specifically high-functioning autism. I was not diagnosed until I was almost 30, in addition to several other conditions. Story 93, Attention Deficit Hyperactivity Disorder. Then anxiety returned, and it was anemia that ultimately turned out to be caused by cancer. Story 94, Attention Deficit Hyperactivity Disorder, and autism with dysautonomia and eosinophilic esophagitis. Story 95, Mine was definitely psychosomatic pain caused by my severe anxiety. Once I started taking medications and began therapy, I was essentially cured of that particular feeling I had experienced for years. Story 96, I had lower abdominal pain for 2 years until an obstetrician and gynecologist performed an ultrasound and determined my fallopian tubes were 3 times their normal size. I had the fallopian tubes removed, and the pain subsided. I still have an anxiety disorder, but I knew the pain was not caused by it. Story 97, Late at night, I went to the emergency room with intense abdominal pain. They said it was anxiety and gave me a muscle relaxant. The next morning, I was still in severe pain and began vomiting. My family doctor immediately suspected appendicitis. An ultrasound showed my appendix was about twice its normal size and at risk of rupturing. I had surgery that day. Story 98, After a long series of tests and much anxiety, I had a good cry of relief on the couch and never experienced that pain again. Story 99, For me, it was postural orthostatic tachycardia syndrome. I had my first fainting episode last week and have been fainting every 2 to 3 days since. It has become extremely debilitating even though nothing has changed, and I feel very discouraged. Story 100, I had a hiatal hernia. I thought I was having a heart attack for years. Doctors said they were just panic attacks. I was put on so many psychiatric medications. During an unrelated abdominal surgery, they found and repaired the hernia. The symptoms disappeared immediately. Story 101, Panic disorder. It may have been only anxiety at first, but by the time I began seeing doctors, it had progressed beyond that. Story 102, It was lupus. I will send you an invoice for making house jokes. Thanks. Story 103, Not being diagnosed with attention deficit hyperactivity disorder and autism spectrum disorder makes you anxious. Receiving treatment reduces anxiety. Who would have thought? Story 104, I had undiagnosed autism and attention deficit hyperactivity disorder and was unknowingly masking heavily while trying to keep up with neurotypical expectations. Story 105. One time I had pneumomediastinum. I have no information about the other conditions. I do have anxiety. Story 106. Obsessive-compulsive disorder stole almost a decade of my late 20s and early 30s. Why our brains would do that to us is still beyond me. Story 107. My husband was diagnosed with a brain tumor and primary central nervous system lymphoma. It was not anxiety. He is on his second round of chemotherapy now. Story 108. Bipolar II disorder, attention deficit hyperactivity disorder, obsessive-compulsive disorder, autism spectrum disorder. It was wild to be diagnosed at 30 after spending my entire life being talked down to for not being neurotypical. Story 109. I had preeclampsia and fluid in my lungs about a week after giving birth to my son. I was told repeatedly that my shortness of breath was due to having had a cesarean section and hormonal changes. So I must be anxious. Story 110. Serotonin syndrome caused by a child-sized dose of Prozac, 10 milligrams. Story 111. I was told by a doctor that my crippling anxiety was just from being a 16-year-old girl. Over 10 years later, I still have an anxiety disorder. It turned out the anxiety and depression were linked to untreated attention deficit hyperactivity disorder that my doctor did not check for. Story 112. Type 1 diabetes. Both very low blood sugar and high blood sugar trigger an intense fight or flight response. Story 113. I had atrioventricular nodal reentrant tachycardia, received an ablation, and have not had the tachycardia again. Story 114. After seeing an optometrist, I went to the doctor because I was having trouble concentrating on tiny measurements while woodworking. The doctor said it was stress. 5 days later, a vein in my brain ruptured, causing a massive stroke and blindness in one eye. I am still recovering slowly. Story 115. Cerebrospinal fluid leak. I lost my hearing for 2 days, and an advanced practice registered nurse diagnosed me with anxiety. I had never experienced anxiety before and had deployed to a combat zone. I did not think anxiety was causing my hearing loss, but I was anxious about losing my hearing. Story 116. I was put on antipsychotics and hypnotherapy for an obstruction in my small intestine. Story 117. A brain tumor is causing rapid weight gain, constant migraines, permanent damage to my pituitary gland and thyroid, and acromegaly. Story 118. Hope this helps someone feel better. It was, in fact, just anxiety. I had trouble breathing and swallowing, and it always felt like I could not catch my breath. This started around the coronavirus disease 2019 pandemic when there were layoffs everywhere, and I was anxious. I had mostly forgotten about it until I saw this thread. It lasted several months, maybe a year, and then tapered off. Story 119. I had thyroid cancer. I was told I was just anxious and stressed. After 2 years of hearing that, when my cancer was finally found, it had spread considerably in my neck. I learned a lesson from that. I no longer let doctors tell me how I feel. I knew my body was telling me something was wrong, but I kept getting dismissed. Story 120. During labor with my son, I was not progressing beyond a dilation of 5 centimeters. I physically could not, just like my mother, whom I had mentioned to the team multiple times. After an epidural, an emergency cesarean section, a hemorrhage, and a blood transfusion, it became clear it was not just anxiety. I will never have more children. Story 121. I had a heart defect and anxiety. After my life-saving surgery, I continue to have anxiety and now also have post-traumatic stress disorder. I am not sure whether it was worth it. Story 122. Delirium tremens, ketoacidosis, and cannabinoid hyperemesis syndrome. Story 123. Dysautonomia can occur during perimenopause. Dysautonomia means the autonomic nervous system goes haywire and causes unpredictable problems with breathing, blood pressure, temperature regulation, digestion, pain perception, heart rate, cardiac function, muscle control, nerve function, and other body systems. Story 124. Autism. I should have figured it out when 2 rounds of selective serotonin reuptake inhibitors had no effect on my anxiety. Story 125. Endometriosis has spread throughout my abdomen, causing my internal organs to become connected. Story 126. Anxiety. I thought I was having serious heart problems. Never in 1,000 years did I think it could cause so many physical symptoms and become debilitating. Story 127. Apparently, I cough and then cannot breathe for a solid minute. Then I panic, and there is a high-pitched noise as I finally get air into my lungs. This is interpreted as anxiety rather than the obvious diagnosis of whooping cough. Story 128. I'll let you know when they finally diagnose me. I'm on the hamster wheel of never-ending tests. It doesn't help that I actually have anxiety because once you have it, everything feels like anxiety. Story 129. I was told it was just stress and anxiety, but it turns out I have debilitating chronic migraines. Story 130. Attention deficit hyperactivity disorder. I showed many signs, but because it was considered a predominantly male disorder, they did not take me seriously. My entire life, I was treated only for anxiety and given selective serotonin reuptake inhibitors. Psychiatrists, doctors, and therapists shrugged when I said the medication was no longer working. They simply prescribed a different one, and the cycle repeated. One psychiatrist was flabbergasted when I told her that the two selective serotonin reuptake inhibitors she had put me on at the same time, without mentioning that this could be deadly and cause serotonin syndrome, were only about 30% effective. After leaving her and finding a new psychiatrist and therapist who actually cared, being retested for attention deficit hyperactivity disorder, which showed a 99% probability that I had it, and starting stimulant medication, I finally felt relief. It took more than 20 years to be taken seriously. Story 131. In hindsight, my crushing sensory issues and social difficulties, among other things, were clearly autism, but I'm very femme-presenting, so I was told it was just anxiety. I do have severe anxiety, but that is a different condition. Story 132. My grandma was told it was anxiety, and I kept telling her anxiety does not make you breathless when walking. It can make you feel that way during a panic attack, but not just walking down the road. It turned out she needed triple bypass surgery. Story 133. Anxiety that requires medication is not just a situation. It is a medical condition. Story 134. I saw 3 or 4 doctors before one would listen and give me a referral to a psychiatrist for diagnosis. By that time, I had been on my 3rd antidepressant, had seen my 4th counselor, had worked with a hypnotist, and had been through about 20 jobs. Story 135. It was postural orthostatic tachycardia syndrome. Even today, when I explain what it is to people, they usually say something like, "Oh, so it's just bad anxiety?" No, it is a neurological condition, and my nervous system overreacts frequently. Story 136. For about 10 years, I had chest pain that felt like a jolt of electricity occurring randomly throughout the day. It was surprising and painful. I saw specialists everywhere. None gave me a straight answer, and one pulmonologist said it was due to anxiety. Years later, I went for an exam while I was sick, and the nurse asked about pain. I told her, and she immediately said it was nerve damage from my lung surgery. She said that is common and usually resolves over long periods of time. It all clicked, and we talked about how I had been trying to get an answer for years. The pain eventually went away. The incompetence I witnessed before that remark made me question the medical education system. Story 137. I have anxiety and premenstrual dysphoric disorder. When other people who menstruate say they hate premenstrual syndrome, I thought it was normal to experience suicidal or homicidal thoughts and uncontrollable crying all day. For the record, it is not normal. Talk to your gynecologist. If they dismiss you, find a different doctor. It could save your life. Story 138. How the fuck should I know? I just have to work hard and everything will be fine. Story 139. Anxiety. People do not understand that it is not just a substitute for everyday stress. It took a severe panic attack in front of my parents for them to realize what it was like for me. Story 140. Complex post-traumatic stress disorder, inappropriate sinus tachycardia, and mixed neurocardiac reflex. Story 141. Irritable bowel syndrome. At least the doctor asked for other tests after initially saying it was anxiety, and those tests led to what seems to be the correct diagnosis, or at the very least, an effective treatment. Story 142. Attention Deficit Hyperactivity Disorder. Once I started taking medication for it, my lifelong anxiety went away and I started to be a superstar at my job. It helped my marriage too. It was life-changing. Story 143. It appeared to be anxiety, but it stemmed from undiagnosed attention deficit/hyperactivity disorder and autism. The major panic attacks were actually meltdowns associated with autism from being overwhelmed and overstimulated. Story 144. Post-COVID condition, mast cell activation syndrome, postural orthostatic tachycardia syndrome, and other forms of dysautonomia, myalgic encephalomyelitis commonly known as chronic fatigue syndrome, joint hypermobility, and other related conditions. Story 145. Repressed memories of being sexually abused as a baby by my mother. Story 146. Critical anemia. I had let it go for so long because everyone convinced me it was anxiety. 2 doctors said I would not have lived 48 more hours. I was admitted to the intensive care unit. Story 147. Perimenopause affects women and can begin earlier than you think. Story 148. The gallbladder is filled with stones and could burst at any minute. Story 149. Idiopathic subglottic stenosis. It turned out my breathing difficulties were caused by a 75% airway blockage, and being told to just calm down did not help. Story 150. Between when I started taking Singulair and Montelukast for my asthma and when my anxiety and mental health really bottomed out, the Food and Drug Administration issued a black box warning. I had been taking it for about 6 years. My doctors had no idea it had received that classification until I showed them. I found out from a post on Twitter. Within a month of stopping it, I was a completely different person. It absolutely changed my life. If you need an antilucatrine medication for asthma or another condition, there are options that do not make you feel like you are going to die. Story 151. My feet went numb, and I was told it was probably just anxiety. It turned out to be Guillain-Barré syndrome. It is the #1 non-traumatic cause of paralysis. Story 152. I had the worst stomach pains for months and lost over 8 stone in 10 months. That made the doctors think it was something more serious. After many tests, it turned out it was probably anxiety. I honestly thought I was on my way out, and several doctors did as well. I'm pretty sure it was just anxiety. Story 153. I was told my chest pain was just anxiety. I know my anxiety and panic attacks. This was not a panic attack. I felt anxious because I was having sharp, stabbing chest pain. The anxiety did not predate the pain. I took my prescribed clonazepam at home and it did not resolve the pain. I was right. It was gas pain. Story 154. It was anxiety. Severe anxiety ruined my life, but people do not understand how bad it can be. Story 155. I had high blood pressure and a rapid heart rate and felt very afraid. It was an infection or abscess of a molar that had undergone a root canal. I had no pain and no other symptoms. Story 156. In my father-in-law's case, it was a heart attack caused by 3 almost completely blocked major arteries. This followed more than a year of chest pain and shortness of breath, despite multiple visits to a cardiologist. His heart muscle was healthy and his blood pressure was excellent. He was very fit, although he had smoked for decades and quit about 10 years earlier. He was diagnosed with anxiety attacks, and his doctor said that was causing the chest pain. On the day of the heart attack, he thought it was an anxiety attack. We are fortunate his wife called emergency services when his symptoms worsened. He survived, and more than a year later, he is doing well after a triple bypass and a very scary few weeks. Unfortunately, doctors sometimes minimize men's symptoms as well. Story 157. For my daughter, it was celiac disease. She always felt awful, with a pit in her stomach and throat. Story 158. Lupus, Raynaud's, Sjogren's, mixed connective tissue disease, spondylitis, nerve damage, and tendon damage. I was fortunate. It took 2.5 years to get a diagnosis. Unrelated to the autoimmune conditions, I have autism spectrum disorder, formerly known as Asperger's syndrome. Story 159. Post-traumatic stress disorder. I thought this was just anxiety for years. Meanwhile, I lost a lot of weight, suffered insomnia and nightmares, experienced hair loss and malnourishment, had auditory hallucinations, struggled to regulate my emotions like an overstimulated, exhausted toddler, and remained in a constant fight or flight state. Story 160. It was anxiety, but it was severe, crippling, and needed to be treated, not written off. Story 161. I have attention deficit hyperactivity disorder and autonomic dysfunction, which includes postural orthostatic tachycardia syndrome and gastroparesis. I am still working on identifying other symptoms, potentially neurologic or autoimmune in nature. Story 162. I had anxiety and panic attacks, but the cause was low progesterone and high estrogen. Took a while to figure out. Once I corrected my hormone levels, I was fine. Story 163. I was diagnosed with severe chronic anxiety in high school. I self-medicated with lysergic acid diethylamide, psilocybin mushrooms, and 3,4-methylene-dioxymethamphetamine. It worked. Story 164. I had type 1b diabetes and experienced vomiting, diarrhea, and weight loss. Story 165. Supraventricular tachycardia. I would have spells where my heart started beating incredibly fast and I could not slow it down. I was told it was probably panic attacks because I was a very anxious person. Later, I started having panic attacks that presented very differently, so we had my heart checked. Turned out I had an extra nerve in my heart that caused a short circuit. Story 166. I developed Guillain-Barré syndrome. I went from numbness and tingling in my extremities to being unable to walk in a matter of days. I was paralyzed and hospitalized for 2 months and required outpatient physical therapy for several months afterward. During my hospital stay, I lost almost all feeling and the ability to move from my chest downward. I also developed dysphagia, which led to pneumonia and required treatment in the intensive care unit. Story 167. I told ChatGPT that I had racing thoughts, but they always happen and I did not get the physical reaction of anxiety. When I was little, doctors said it was anxiety and gave me Prozac. It made me feel very off. The doctors tried a different variant, then another, increased doses and combined multiple types, and I learned the hard way that my body cannot tolerate selective serotonin reuptake inhibitors. In the end, ChatGPT suggested autism or attention deficit hyperactivity disorder. I pursued that and found a clinical psychologist with a Doctor of Philosophy degree who tested me for 6 hours. The results showed I was strongly struggling with ordinary tasks, and the anxiety I experienced was really just how my brain is wired. Story 168. I am a teenager and my mom keeps saying that it is just anxiety, but I do not know if it really is. I take medication for anxiety and my dose will increase in about 2 months, but I have been having frequent sensations of fever even though my temperature is normal, severe stabbing chest pain, headaches, and cramps throughout my legs that hurt so much they are almost numbing. I also have an elevated heart rate, and I have not had my physical yet because I do not do sports. Is it just anxiety? Story 169. Women I know, older women, thought or were told their shortness of breath was anxiety or asthma. It turned out to be heart failure or heart attacks, and in one case a woman had a complete blockage of her left anterior descending artery. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.